Hi, my name is Monique. I am the owner and a therapist at a mental health practice. And when I first started, we used KASA software and then we switched to TherapyNotes. For more information, click below. KASA and TherapyNotes are both software programs that really empower a clinician to take notes, to schedule client sessions, to do diagnostic documentation, and there are venues for billing as well. Well, Therapy Notes is best for all things clinician and all things patient. In this time of COVID, when we have a really difficult time meeting face to face for one reason or another, then we have the ability to upload all of the new client documents into their portal. They can fill all of those out prior to their session, and we can schedule from my end. I can schedule patients, and the patient can schedule on their end as well. What I really appreciate is being able to utilize telehealth that is embedded in Therapy Notes. I can use an administrator who answers calls to access the patient information and to add new patients. I can do that as well, and the patient can also access. So there's so many really awesome things about Therapy Notes. I can't describe all of them because time is limited, but those are some of the highlights. So when I was with KASA, I started with them because someone else had been using the software program and that was all he knew. And since I was a beginner, I just jumped right in. Well, I had to sign a contract and their rates at the time were $1,200 a month for me doing full-time private practice. I don't pay that with the software program that I'm with now. I don't even pay I might pay 10% of that now. Um, we were promised that they would do our billing for us, that it was seamless billing. But after about maybe a year of working with them, and I enlisted another therapist who's really good with details, she was able to look at things and she found that some of the services that they were supposed to bill for, they didn't. We tried to end our contract with KASA amicably, and KASA tried to charge us a fee, a hefty fee, for canceling our contract early. But we were able to get that resolved because we documented everything. But I'm just the fees and them not following through with what they said that they were going to provide was really problematic. So startup with KASA was not as tedious as it would be for someone with a full caseload because I was just starting my practice. So each new patient that came on board, I entered their information and got them established. Very similar to Therapy Notes. A new patient comes in, you put in some basic information. What I do like about Therapy Notes, though, is that the client's portal that has their new client information, they can type in most of that information. And when I put in their name and their email and their phone number, it pulls all of their information forward just by a click of a tab. So the top considerations for me now that I'm kind of a little bit seasoned, 3 years into my own practice, and having been able to use Therapy Notes, they have everything that I would look for. They have the patient accessibility. They have low fees. Appreciate that so much. They have added features that you can utilize if you'd like. For instance, insurance verification at pretty good, affordable rates. I would be looking for uh, the ease of me being able to use the service because I'm not the most tech savvy. Um, and I would be looking for documentation. So when I was with KASA, they did not have um, documentation that would meet licensure requirements. If we had been audited, we could have really, we could have taken a hit. But when it comes to TherapyNotes, they continue to improve their services, and they have a diagnostic form that I can fill out. They have a crisis plan in the library that I can use. I can upload any documents that I need that may not be included, but they have so many excellent documentation. They have up to date DSM 5 diagnostic, all of the diagnoses that you can bring up. They have all of those. And then also, this is top of the line. Their customer service, I think, is probably second to none. You can reach a customer service representative almost anytime. So those are the things that are really important to me, and those are all of the things that they offer, as well as the embedded telehealth option. Really appreciate that too. I can't say enough about TherapyNotes. I really, really appreciate them.